All right, welcome to Unit 3, Protecting Children's Physical Health and Safety. The essential question of this unit is what can parents and other adults do to keep children healthy and safe, and how can parents treat children's illnesses and injuries when they do occur? Okay, so Section 1 is maintaining children's health. After studying this lesson, you're going to be able to describe the aspects involved in basic health care for children, including meeting children's physical needs and providing children with preventative health care. You're going to give examples of 2 health screenings that are important for young children. You're going to be able to differentiate among the terms immunization, vaccine, and vaccination. You will be able to compare and contrast communicable diseases and non-communicable diseases, identify 5 ways to prevent foodborne illness, and explain what causes diabetes, epilepsy, allergies, and asthma. Children, like adults, need basic health care to ensure their bodies are developing properly and to treat infections and diseases. When health concerns are prevented, detected early, or treated properly, children have a better chance of leading a healthy and happy life. When disease or injury occurs, children who are otherwise healthy tend to recover quickly and completely. Neglecting health needs for long periods can cause health conditions with lasting effects. To promote children's health and safety, you must meet their physical needs and provide children with preventative health care. Every person has basic physical needs. As you may recall, children's needs depend varying on what stage they're in. Young children rely on adults to meet all their physical needs, like babies do. As children grow older, they're capable of meeting some of their own needs. Adults, however, still pay careful attention to and meet many of children's needs. Adults help meet children's needs by ensuring children eat healthfully, get plenty of rest, and are physically active. Maintaining cleanliness can protect children from certain illnesses like the flu or common cold. Adults can reduce children's risk for infection by encouraging proper hand washing, teaching children to cover their sneezes and coughs, teaching children to not touch their eyes or mouth when around sick children, and modeling good health practices. The correct way to wash hands is to wet your hands with water and apply soap. Children like colorful foamy soap. Antibacterial products are not any more effective than other types of soap and may give rise to antibiotic-resistant bacteria, so maybe don't use antibacterial soap. Rub the soap between hands, on back of hands, between fingers, and under fingernails. Scrub your lathered hands for at least 20 seconds. Some sources say 30 seconds of scrubbing is needed. You can sing the happy birthday song twice while scrubbing, and then that becomes the right amount of time. Rinse your hands thoroughly and dry your hands with a clean towel or air dry. Part of meeting children's basic needs involves adults providing children with preventative health care. Preventative health care consists of measures taken to keep children well. Preventative health care includes regular doctor and dental appointments, health screenings, and immunizations. Proper preventive health care for children involves regular well-child checkups. These are doctor's appointments when the child is not sick. During these visits, doctors monitor children's health and wellness and check their growth and development. They note children's eating, sleeping, and playing habits. Doctors also answer parents' questions about their child's development. Well-child checkups may reveal possible health concerns before they become serious and cannot be repaired. These visits may even prevent certain health conditions altogether. Because well-child checkups are so important, doctors suggest a schedule for regular visits. The schedule varies slightly among doctors, but the American Academy of Pediatrics suggests children have 11 well-child checkups during the first 3 years of their life. This does not include checkups made between birth and discharge from the hospital. Yearly examinations are recommended after 3 years of age. Infants of nursing mothers and premature infants may have extra checkups during their early weeks to ensure they are thriving. Children also need regular preventative dental care from a pediatric or family dentist. Dental care usually begins by their first birthday, with follow-up appointments every 6 months after that. Parents often have difficulty choosing health care for their children because there are so many health care providers available. In most regions, pediatricians and dentists are everywhere, and parents are not always sure how to decide which healthcare services will best meet their children's needs. Parents need to assess prospective medical personnel. To choose the best healthcare services for their children, you need to consider several factors. Is the medical provider within the parent's insurance coverage network, and will the provider accept their insurance? Are office hours and location accessible? Is the medical professional open to parent questions? Will he or she answer parents' questions clearly and calmly? Is he or she accepting of emergency calls? Will all licensed pediatric doctors and dentists, are they all qualified? While all of them are qualified to work with the child, parents often consider the older child's preference when choosing a medical Professional. Choosing a doctor or dentist the child likes will make the child less anxious during examinations. Children generally like friendly medical personnel who greet them by name and smile. They also prefer colorful treatment rooms and pleasant waiting areas. Health screenings are standard tests that look for potential conditions or diseases that may affect children's health or development. These screenings aim to detect conditions often before symptoms appear, allowing for diagnostic confirmation and early treatment. The AAP recommends that children receive several health screenings at certain points in their development. Some of these screenings, including those for hearing and vision, should be given every year between 3 and 12 years of age, and more often before 3 years of age. Hearing and vision screenings are especially important for young children to help prevent developmental lags and some medical conditions. Health screenings also exist for certain special needs, such as autism, and for some infections and diseases, such as depression and sexually transmitted infections. The AAP website contains more information about health screenings recommended at each age. Some of these health screenings are conducted during well-child checkups. Providing children with preventative health care includes immunization, which is a process to protect children as well as adults from certain serious diseases. Substances used to produce immunity, the body's ability to resist infection from diseases, are called vaccines. Vaccines can be administered through injections, oral medications, or aerosol sprays. Some illnesses require a series of vaccines to produce immunity. The process of administering vaccines is known as vaccination. Children's health is dependent on their immunity, which is their body's defense against infection and disease. There are two types of immunity: active immunity and passive immunity. Active immunity results when a body produces antibodies, which are proteins in the blood that destroy toxins and disease-carrying organisms. Active immunity occurs through direct exposure to an illness or through vaccination, and takes several days or even weeks to become effective. Once developed, however, active immunity lasts several years or an entire life. Passive immunity results when antibodies are produced by one person's exposure to a disease and then passed to another person. This is what happens when mothers pass antibodies to their unborn babies across the placenta. People also receive transfusions of antibodies that are made by someone else's body called antiserums. Unlike active immunity, passive immunity takes effect immediately but lasts only a few weeks. Immunity can be naturally or artificially acquired. Natural acquired immunity, sometimes called natural immunity, is developed after direct contact with infection or by receiving antibodies from the mother during pregnancy or breastfeeding. Artificially acquired immunity forms as a person's reaction to antibodies or an antigen received through medical care. Antigens are substances made from bacteria, viruses, or toxins that prompt the body to produce antibodies that fight a disease. These substances are made in a laboratory and transferred to people in the form of vaccines. You should know the answer to this because I just discussed it on the previous slide, but if you have no idea, maybe rewatch the previous slide again. From birth, children are given vaccines to cause immunity. In the U.S., all states require children receive certain vaccinations for school admission. Although vaccination laws vary from state to state, some of the diseases children must get vaccinated against include diphtheria, pertussis, which is also called whooping cough, measles, rubella, which is German measles, mumps, tetanus, polio, and chickenpox. There is an immunization schedule that is recommended for children from birth through 18 years of age, and recommendations are reviewed and updated regularly. Doctors record children's vaccines on immunization records and then check these records before giving more vaccines. Parents should keep records too for their own information. Children's immunization records often need to be provided for entry into childcare and education programs, schools, and camps. In rare cases, parents may submit a request for their child to be exempt from immunization due to religious or personal beliefs. If children who are not vaccinated become infected, however, these diseases can cause serious illness and even death. Unvaccinated children may also pose a greater disease transmission risk to other children and adults who cannot be vaccinated due to age or medical conditions. So what do you guys think? The CDC recommends a certain timing of immunizations. What do you guys think about public policy related to vaccinations? Should we tell people to get their kids vaccinated or not? So are you an anti-vax or yes, we should vaccinate children? Think about your opinion. All right, now to talk about communicable diseases. These are diseases that can be transmitted from an object to an individual or between individuals. The flu is an example of a communicable disease. Okay, some other examples of communicable childhood diseases include chickenpox, a cold, conjunctivitis, Coxsackie, diphtheria, head lice, hepatitis B, impetigo, influenza, measles, meningitis, mumps, ringworm, rubella, scarlet fever, strep throat. Okay, so there are lots of communicable diseases. Some of these can be prevented with a vaccine. Another type of communicable disease is spread through food. Foodborne diseases, also called foodborne illnesses, are caused by eating foods that are contaminated with harmful bacteria and other pathogens during food production or preparation. Examples of foodborne illnesses include botulism, E. coli, listeria, and salmonella. Young children are at a high risk for foodborne illnesses and can suffer serious side effects. To prevent foodborne illness, adults should pay careful attention to food safety, which involves keeping food preparation area clean to avoid the spread of harmful bacteria, washing utensils, dishes, and preparation supplies thoroughly with soap and water to prevent cross-contamination, which is the spread of bacteria from one food to another via an object, ensuring that all meats and egg dishes are cooked to proper temperatures, storing food safely before preparation and storing leftovers safely after preparation, keeping foods at recommended temperatures, which means keeping hot foods hot and cold foods cold, returning foods on recall, and notifying your physician if these foods were eaten prior to the knowledge of this recall. Non-communicable diseases are diseases that cannot be transmitted between an object and an individual or between individuals. Examples of childhood communicable diseases include diabetes, epilepsy, allergy, or asthma. Okay, diabetes is a disease that occurs as a result of the body's inability to produce enough insulin, which causes too much sugar in the blood. Children may develop two types of diabetes, type 1 or type 2. Type 1 is a condition in which the pancreas produces little or no insulin. This type begins before the adult years. The cause is mainly genetic, but other unknown factors may contribute as well. Type 2 occurs when the body becomes resistant to the effects of insulin or when the pancreas does not produce enough insulin to maintain a normal blood sugar. The onset often occurs in the adult years, but school-age children are becoming more and more vulnerable. Causes of type 2 diabetes are genetic and lifestyle related. Genetic factors include a person's ethnicity and age. Lifestyle related factors include poor diet and lack of physical activity. The symptoms are similar for both type 1 and type 2 diabetes. Symptoms include increased thirst and urination, intense hunger, weight loss, fatigue, blurred vision, and slow healing sores. If blood sugar drops too low, a person can go into a diabetic coma and die. Type 1 diabetes requires consistent care, blood sugar monitoring, and insulin delivery. Type 2 is treated by diet and physical activity to manage weight. If the condition worsens, oral medications or insulin treatments are needed. Epilepsy is a neurological disorder in which abnormal activity in brain cells causes seizures. Seizures are sudden attacks that vary in intensity from a blank stare for a few seconds to convulsions with loss of consciousness. Although seizures may vary in frequency and intensity, most people have repeated seizures. Epilepsy often begins in childhood and may be caused by defective genes or traced to accidents, diseases with high fevers, or medical trauma. Medications can help control epilepsy. Patients with severe seizures may wear helmets to prevent head trauma during a seizure. Knee pads and elbow pads may also be worn to help prevent head injuries. Some children have service dogs that sense and warn them of upcoming seizures, allowing these children to get to a safe place quickly. Allergies are the greatest cause of chronic health conditions in young children, affecting over 1/4 of all children. An allergy is a negative reaction by the body's immune system to an allergen. An allergen is a substance that causes an allergic reaction. Symptoms of allergies may vary from cold-like symptoms or wheezing to anaphylaxis, which is life-threatening shock. Immediate treatment for severe allergic reactions requires epinephrine injections, an EpiPen. Okay? Types of allergens, foods usually, like the most popular foods are cow's milk, tree nuts, chocolate, wheat, peanut, eggs, soy, fish, and shellfish. And then there's some medicines that are taken by mouth. Symptoms that you're allergic would be a tingling mouth, a swelling of your tongue, face, or throat, hives, and then anaphylactic shock. Another types of allergens include insect bites and stings, medicines that are injected, thorns. Okay, you might get swelling at the site of the injection, coughing or wheezing, hives, or anaphylaxis. People can also be allergic to latex or other touched substances. You'll get itchy skin, flaking or peeling skin, or redness of skin. And then airborne allergens, which can cause congestion, itchy and runny nose, itchy watery eyes, dark circles under your eyes. Okay, allergies can be treated by removing or limiting contact with the substance, cleaning regularly to remove dust mites, or staying inside as much as possible when the pollen count is high. Using drugs that control allergic reactions like antihistamines, decongestants, and bronchodilators. And then receiving injections or other forms of administration of some allergens to desensitize the body, which we call desensitization therapy. Lastly, asthma is inflammation of the airways, the most common chronic disease of childhood. Onset of asthma in children usually begins before 5 years old. 85% of asthma cases are triggered by allergens. Symptoms of asthma vary from coughing and wheezing to shortness of breath. Asthma can be aggravated by a virus, secondhand smoke, cold or dry air, and exercise. Asthma may lead to a number of other respiratory problems. Adults can take some measures to reduce children's risk of asthma. Oral, inhaled, and injected medications can also be used to help prevent attacks and to treat ongoing ones. In order to reduce the risk that your child may get asthma, you can breastfeed children for at least the first 6 months of life, introduce solids after 6 months of age, and give only 1 tablespoon or less of a new food and wait 5 or more days between the introductions of new foods. So that way, if they have like an allergic reaction, you can tell which food it was. Reduce children's exposure to some allergens, including dust mites, mold, air pollen, secondhand smoke, and cockroaches, and expose children to pets early in life. Children raised on farms are less likely than other children to develop allergies and asthma. All right, that is the end of section 1. Thank you.